Alrighty, Ross, thank you. Well, all of this week, we are getting you ready for back to school. And for a lot of kids, that means back to sports. But before you hit the soccer field or basketball court, parents and coaches are being warned about the dramatic rise in ACL injuries. Every year, about 400,000 athletes are sidelined due to a knee injury. But locally here, doctors at Midwest Orthopaedic at Rush say their ACL patient numbers doubled in the last 5 years. And those under age 25, listen to this, tripled in the same period, particularly female players. Why and how do you prevent it? To find out, we dropped in on a soccer practice of a suburban travel team, the Wizard. Many of these 12 and 13-year-olds have been playing soccer as young as age 3.
I would like to be like professional. I would hope to be, right? Yeah.
This team plays in the highest level of one of the top leagues in the state. It's a team that travels quite a bit, and we've got a number of kids here that play actually made it to the Illinois Olympic Development Combine.
Intense playing, plus starting at a much younger age, are resulting in higher injury rates.
The exposure times are greater for our younger individuals and athletes, and we're seeing an increased number of tears in youth. I've seen them as young as 8 years old.
Dr. Brian Cole is the leading authority on ACL injuries. As the team physician for the Bulls and the White Sox, he operated on Derrick Rose. He says there is an alarming increase in ACL injuries with girls at higher risk.
Many of them are sort of mechanical. If you look at young girls, they have broader pelvis. They tend to be more, they tend to toe out more.
To demonstrate, Dr. Cole shows us a simple screening test.
Alexi, what I want you to do is come down like this and then jump up and land on both feet. Good. Now, she's a great example. So if you watch when she landed, let's say you do it again, okay? So her toes are facing a little bit out. Her knees kind of come in like this.
Instead, the landing should be square with soft toes and legs coming forward. Alexis Parker and Jackie Roberts have both had knee injuries.
When I went for it, my left foot loosened, so it twisted. And so then I fell to the ground and I felt a vibration up my whole entire leg, and then all of a sudden I felt like a really bad pain inside my knee.
I just took my stretches seriously. I did them like every day. I iced my ankle. I did everything I could to get back into the swing.
Today, their travel soccer team heavily emphasizes ACL injury prevention with targeted exercises.
Because when it comes down to the bottom line, it's all about fun, and this is what they love to do. They don't want to be on the sideline. They want to be out playing.
All right, we have a few more notes for you. The return rate after injury is very high. However, studies show ACL injuries in childhood will most likely lead to arthritis of the knee later in life. But I'm going to leave you with some good news. You can reduce your risk of getting an ACL injury by as much as 72% through proper strength training and at least 15 minutes of warm-ups before practice. So it is all about prevention. And here's something else that you can get. This is at kneesforlife.org. It is a nonprofit trying to raise awareness. Now, this is a tag that you can get for free for your kid's sports bag. It reminds them of the exercises that they should do for prevention of ACL injuries. You can find more information and all this report on our website at abc7chicago.com. We'll have a link over to them as well, kneesforlife.org.
It's really, really interesting. And one of those things where the more you know, the more you can prevent these injuries.
Exactly. And they're trying to just get the word out for coaches and parents.
You got a lot of parents that are going to be trying to do that knee test with their kids, too, at some point.